Hello, and welcome to a Practice Growth Tip, proudly brought to you by 360 Dental Marketing. I'm your host, Praveen Gautam. I help entrepreneurs and enterprises to build a digital brand and monetize it. Thank you for past episodes feedback. It was really good. We have a number of special guests, including Albert Geigel, the accountant, and Sue Rosalind, who talked about knowing the numbers. And this episode today would be very different. We're talking about how to enhance your skills, and I truly believe it's a whole 360. Practice growth is not just about communications and marketing, but it's all about the whole 360, which means we're talking about finance, operations, we're talking about HR, and really practice capabilities to increase your both technical skills, your communication skills, or that might be your overall business skills. Now, I can see a number of the viewers are watching this right now, whether you are tuning in from Facebook or you're tuning in from Instagram or LinkedIn, or you might be just watching from YouTube. Just feel free to give a thumbs up, comments, or share this post to a wider community. And I'm sure you would really enjoy this episode today. All right, so I have a special guest today, Dr. Margaret Taylor, who teaches doctors and dentists from over more than 20 years. So let me connect to Dr. Margaret. Welcome to the show, Margie.
Thank you, Praveen.
Beautiful. You are a great role model for me, and I have learned so much in all these years, both in personally as well as in business. And I'm so excited to have you today.
Thank you.
Let's talk about our viewers are curious. Curious to know, because we have got dentist or dental practice owners. So this is more focused for them to add value and to help them to understand this new skill. So could you able to, and I can see you have done a number of training in the past for the, doctors and dentists. Could you, let's start with the basic, if that's okay. So what is, can you tell a little bit about what is prolotherapy, Margie, please?
Well, as well as telling you about prolotherapy, I also want to tell you that it's the most spectacular marketing tool, because in my business, I've never had to advertise, because the results of this technique is so wonderful that people just keep coming back and keep telling their friends. Anyway, so what is this technique? It's called prolotherapy, and it comes from a Greek word meaning growth, prolo, and therapy.
Right.
And it means growing new tissue. And what we do is inject glucose, usually hypertonic glucose, in other words, strong glucose, to initiate the healing cascade, the process by which tissue repair occurs. It's exactly the same as when you have a scratch, a little cut on your skin. The body sends in white blood cells to fix it all up and bring the edges of the wound together, and it does that by making new collagen, which is the third stage of the healing process. So new collagen means that you can repair things that the body has not repaired, such as strained ligaments. And so strained ligaments in dental area, of course, the most important is the temporomandibular joint. But the rest of the body also gets strained ligaments, and once ligaments strain, they become a bit like old elastic, and they don't necessarily initiate this healing response. Muscles do, bones do, lots of blood in those tissues, but ligaments, stringy white stuff that doesn't repair all that well. It does sometimes, mostly in fact, but when it doesn't, it can persist unhealed for 20, 30, 50 years. So when you've stretched a ligament, strained a ligament like an ankle or a TMJ ligament, then the ligament remains loose, and the joint is then able to move in a track that it shouldn't move, and either dislocate or just be painful. And so what prolotherapy does is stops the the stretchiness of strained ligaments. I'm just going to turn off my incoming emails because they're annoying me.
No, that's understandable. Now, so what you are saying, Maggie, is prolotherapy is just injecting a glucose, and I'm a great fan of it. I've done several times. You have helped me, in many times, and I'm sure the viewers would, if you have any questions, feel free to write. So please go ahead, Maggie.
Okay, so we use hypertonic glucose because it's irritating, and it's so simple. It's just like a strong salt solution, but it's hypertonic glucose, and it's irritating enough that it causes ligaments and fascia to repair, which is the most amazing thing, because most of the chronic injuries that we have in our body, it's fascia that doesn't heal. Bones heal, discs heal, muscles heal, but ligaments don't always. So
So I hope that
the other thing we can do with glucose. The other thing we can do with glucose is we can use isotonic glucose, which is even more amazing, because when nerves get irritated or strained, so irritated by, say, a nasty viral infection like shingles, or irritated by being trapped in a scar or in a tight muscle or tight fascia, the nerve distal to that entrapment becomes starving, I suppose is a quick way to say it. And the nerve, because it's lacking nutrients, it starts firing off. And that's pain, basically. And so we can do amazing things with 5% glucose. We can actually turn off nerve pain. And you see this quite a lot. People have jaw pain with the nerve coming up over the edge of the jaw, or trigeminal neuralgia running all over the face, or just the top half or the middle one, or the bottom half, or a nerve that's been injured. Like I can remember a woman that I treated who'd had a anaesthetic injection by a dentist, but unfortunately the injection had damaged the nerve, and she now had chronic pain down in this distribution, which I'm sure you know better than I do. Anyway, I put this 5% glucose to the spot where the nerve was injured. We had to do it a few times, but it worked absolutely well. It took her pain away, step by step, got better and better. So 5% glucose is even more amazing than the hypertonic, which is pretty incredible.
You bet. Right. So yes, considering our dental practice owners, our dentists who are watching this right now, then the question, Maggie, is what can dentists do with it, including their health or the patient's health, how they can take care for a greater good, Maggie?
Well, first of all, our first duty as health practitioners is to take care of ourselves, isn't it? So the wonderful thing about prolotherapy is that you can repair any injuries or any strains. Prabhan just mentioned that the thumb joint often becomes painful in dentists who are using their thumbs all the time doing strong, active movements. The other one that I know is common in dentists is upper back pain, because you're always bending over all the time in a sort of non-physiological position. And so the ligament that runs right down the middle of the back is prone to a process called creep, which means that it slowly gets longer. And this means that the muscles, the paraspinal muscles, have to work much harder to maintain the dorsal posture, the proper posture, and they get very tired. So upper backache, you can often help really delightfully by strengthening the ligament down the middle of the back. The other, I'm sure, you know, most dentists, they're very fit, healthy people. They're out doing sporting things, they strain their knees, or they're getting to my age and they've got osteoarthritic knees, whatever. There's all sorts of things that prolotherapy can help. But of course, you know, you're not supposed to treat yourself. But there are doctors all around Australia now who've attended my workshops and who are able to help with your particular problems. The other thing you can do, and this is most exciting, is to help the temporomandibular joint. This joint, when the person's ligaments around the joint strain, the joint can dislocate forward on that little disc, and then there is reactive muscle spasm, and it's actually quite often the reactive muscle spasm that limits the opening of the mouth. So you can inject hypertonic glucose at various points in and around the TMJ and relieve TMJ pain and dysfunction and noise and so on.
Right. That's very. So what you're saying, Margie, is for their own health and obviously for TMJ, and they can use this therapy, process.
Yep. And also, dentists I know study the head and neck. So your anatomy knowledge of this area is good, and I'm sure you have the ability as dentists to treat head and neck pain. And I know that some of the dentists who attended my workshop have treated head and neck pain and had good results, especially since we have this new technique from John Liftoff in New Zealand using isotonic glucose, where you can help with nerve pain in and around the neck, you know, particularly these nerves that run down the shoulder and up onto the posterior occiput. So you can treat those sorts of pains with 5%. And the lovely thing about that is it's just under the skin, because these nerves are cutaneous nerves. They're not deep, so you don't have to go into all those scary structures. You can just put 5% glucose just under the skin to where, and the patient will be so precise as to where the pain is. And it won't be all the way along the nerve. It'll be in points about an inch apart. Fascinating stuff, really amazing.
You bet. First, you know, I think it was 7, 8, 10 years. I was a little bit scared because I always get too scared with the needles. But, you know, when I did the first time, I remember that was 7, 8 years ago. I just, you know, you don't feel at all. And after all, next day you think, oh, really? So that is, that was just my personal experience. Now that's really good. And I hope the viewers are out there, they have, you know, they understand a little bit about the process, and perhaps if they want to know more, Margie, obviously in last 20-25 years you have helped so many doctors and dentists to teach them, and there's so many dentists right now, or doctors all over Australia as well as overseas. So if they are interested, what can they do?
Well, I could run a workshop next year when COVID-19 travel restrictions are eased. We could do a face-to-face workshop. I usually do them in Adelaide because here I have patients that I can ask if they would like to come and have a free treatment. And so they're quite happy not just to have a free treatment, but they're so enthusiastic about it that they want to spread the word. So they're quite happy to be a part of that process of spreading the word. So it's much easier for me to do a workshop in Adelaide, which means that all you guys from interstate will have to fly to our lovely city and spend a Sunday probably learning all these wonderful things about how to use these two amazing techniques.
And I
So
remember
email me if you would like to.
Yes.
And when I've got enough, I'll run a workshop.
Yeah. So all the emails, all the details are just below. And I know when I was living back in Adelaide a long time ago, there's so many attendees even try to fit out everyone in the same room, or you have to do a number of sessions, or they are flying from all over the place, and not just Australia or New Zealand, but from overseas as well. And number of the workshops they have shown the experience. That's great, Maggie. So that's really I hope that gives a very practical idea for our viewers right now. Now, is there any, I'm conscious with your time, is there anything you would like to say about this treatment, about anything about prolotherapy?
If you want to know doctors who are doing prolotherapy, you could email me and I can email you an Australia-wide list of people that I know. I don't always know how recent or whether they're actually still doing it, but you can always find that out from their secretary. So I can let you know doctors around who are doing it. Secondly, I just want to say again that it is such an amazing technique that you'll always be booked out. I very often have months and months waiting lists because people tell their friends and want to come and have nasty injections to get better. So it really is a wonderful way to enhance your patient load and do amazing good. It's just so gratifying to be able to relieve pain for people in a way that is as natural as possible and that uses the body's own healing response. It's so heartwarming and so satisfying. So I hope you come and learn from me one day and that you enjoy it as much as I do.
You bet. And there's not even now, that reminds me, one of our colleagues who I think you worked or you have teaching, Dr. Jeff Hardings in Brisbane, Sandgate doctor. So he's also done. So as Maggie says, number of, wherever the dentist you are, and whether that may be any GPs, you train the doctors as well, don't you, Maggie?
Yeah.
So feel free to send her a quick email and she's more than happy to guide you through. All right. Thank you so much, Maggie. It's so honored to have you in my show today. I was always keen. I totally believe in that. I have done several times this process, and it's a so joyful and relief for sure, especially who's going through that pain.
I just want to say that if people want to, they can have a look at my website, which is drmtaylor.com.au.
Beautiful. Thank you so much, Maggie. Thanks for your great insight. We'll definitely keep in touch.
Okay. Thank you very much.
Thank you. Thanks. I hope you enjoyed. Today, practice growth tips. My point here today is obviously COVID or post-COVID, though it won't be the same. The way how you treat your patients, the skills you built in, the way how you give experience to your patients, everything would be different for sure. So the key questions for us to deal with it is, how can you transform your practice or your skills from good to great? Thanks for watching. I hope this episode has been valuable for you. I look forward to your feedback. Take care and bye for now.